If the brain is mission control, your heart is undoubtedly the engine room. In fact, the human heart continuously pumps blood throughout a 60,000-mile-long network of vessels, keeping your body running like a high-performance vehicle. But with projections showing that nearly 41% of Americans are projected to have some form of cardiovascular disease by 2030, specialized heart maintenance has never been a more important piece to preventing a catastrophic breakdown.
Echocardiography is really ultrasound that's used to examine the heart. And with regards to flow through the heart, we look for leaky valves and we also look for tight valves. And I'm a cardiac anesthesiologist, so we have patients come to the OR and we examine the blood flow through the heart, both through their natural diseased heart and their heart valves, and then also we look at the valves again once the valve has been repaired or the valve has been replaced. So really, echo is ultrasound that measures the speed of blood flow and looks at the structures of the heart as well.
The procedure is so standard and non-invasive, you probably know someone who has undergone one of the 4 different kinds of echocardiograms, starting with the most common, transthoracic. If necessary, a transphageal echocardiogram is taken for a more detailed reading, stress to detect coronary artery disease, or fetal to see an unborn baby's heart without surgery or X-ray.
Well, echocardiography is a really cool technique. It actually works with sound waves. So similar to what a submarine does. So you throw sound waves and they hit certain structures and you get an echo back. And that echo is then translated into an image. Even when I was a young cardiologist many years ago, I saw for the first time an ultrasound and I saw the heart moving and beating, and it made such a big impression that I decided at that time that's what I want to learn and that's what I want to do.
With an echocardiogram and with an educated pair of eyes, you can look at the entire structure of the heart. You can look at the function, not just the anatomy of the entire heart. And you can, if you're trained, you can recognize abnormalities that should demand additional treatment, including those that can be life-threatening. We would go, in terms of diagnosis, to what we call invasive procedures, putting catheters into the heart, introducing them into the body, measuring pressures, injecting dye, taking X-ray pictures. That was pretty much what we had available. So there is no question that we missed a lot of conditions that we now recognize with echocardiography, including conditions that run through families where the implications are not just to the patient having the test, but to that patient's family members.
The heart evolves throughout the years, from in utero to advanced age and things in between. And also there's special individuals who do, for example, endurance training. And actually quantify it is important. We actually make measurements and then know if that's a normal heart or a diseased heart and have to predict then the future for that person. You have precision in your diagnosis, and therefore the better diagnosis you make, the more precise diagnosis you make, the better treatment you're going to offer and the appropriate outcome for patients is going to be realized. I think we'll get better care and better outcomes in our patients for heart disease and cardiovascular diseases.
I'm very privileged and fortunate to be the president of the National Board of Echocardiography. I've been part of the organization for probably over 20 years. I started out as a question writer. I would write questions for the exams, and over time I came onto the board, and I was lucky enough to be elected as an officer and serve as the current president of the NBE. So the mission of the NBE is to promote excellence in cardiovascular care. It's a unique board certification organization because most board certifications stay within one specialty. But the NBE is unique because it combines both cardiologists, anesthesiologists, And now we're actually involving critical care physicians who may have a background in pulmonology or surgery or some other type of specialty. So different specialists now are coming together for the same goal of producing examinations and standards for board certification across all those specialties.
If one wants to learn echocardiography, one is definitely exposed during a general cardiology training program, but there are many people who choose to do extra training in echocardiography after that 3-year training program is completed. But as echocardiography has become more widely used, another large group of people are those who are cardiovascular anesthesiologists, the people who take care of you when you're undergoing heart surgery. Echocardiography is very much a part of those procedures, and cardiovascular anesthesiologists also become board certified in echocardiography.
You can have a handheld device, namely the size of your cell phone, and you can get images by applying it to the chest with some coupling gel and get images of the heart. And right away it can tell you heart size, heart function, but you better be good at reading it, because if you're not, you're going to make mistakes, and mistakes can also be adverse. So you want to put it in the hands of a skilled person who knows how to make the interpretations and what to do. Echo has been basically the very special thing that's come in my life for cardiology and professional training and my career academically. So I started, training as a cardiology fellow and cardiologist, and echo became one of my passions. It was very intrinsic, it was intuitive, and I become the immediate past president of the National Board of Echo. And that's an organization that's critical, I think, to fundamentally maintaining competency and special competency in those who want to employ this craft. And it's just a passion that we all have and we all share. And it continues to have great horizons, and we're going to be even doing more as the future comes with echocardiography.
Ask if the physician reading your echo is NBE board certified, or visit echoboards.org.